Scalability, and that's what I was worried about. I can't keep bringing it to the home. I need to be able to do it in the home, face-to-face with the caregiver, but through electronics. Hopefully we'll have subjects from across the country, but we could replicate it in much larger studies if it seems to be effective. This study, I only anticipate recruiting 100 caregivers, and 50 will be assigned to the problem-solving therapy intervention. The other 50 will be just doing the surveys. At baseline, 1 month, 3 months, 6 and 12 months after they would have received an intervention. And they'll teach us what it's like to be a caregiver of a vet with TBI. They'll be answering the same surveys about their burden levels and their depression levels. And so we'll compare it to usual care at this point. Where my other interventions, I've compared them to a nutritional intervention that was matched for the time and attention. But due to the financial constraints in this grant, I just decided to use usual care as the comparison intervention and just learn what are they doing for usual care and what burdens are they faced with. Definitely. I think it could be applied across populations. People have asked about, what about caring for a child with autism? I think caring for an older adult, definitely. Anybody who's in a caregiving role, the problem is that you've lost that relationship, and usually that relationship, there's a lot of give and take, and all of a sudden you're just giving, and there's not much taking. So a part of my intervention is to ask the caregivers to do something pleasurable for themselves every week or two. And if they can't find anything pleasurable to do, then that becomes a problem that they can work on. If we don't do something to take care of ourselves, we won't be able to stay in the caregiving role indefinitely. It can. I've done 1-year outcomes, and what I've found is that the effects of the intervention seem to weaken at 6 months after the intervention. So my next study, I would like to propose that we do booster sessions at 6 months and see, and maybe go out 2-year trajectory so that we can see the more long-term effects. The caregivers that get a booster session, do they have more positive outcomes? Because I'm thinking that we need a caregiver partner or somebody to help the caregivers along the trajectory, that we may not just be able to drop them after we give them problem-solving skills. The caregivers are not considered patients by physicians. They're not really the one that needs treatment, so this is really hard to make a case for. They're not billable, but they're the ones that are going to provide the care into the next generations, and I think it's an important area that we address their mental health. Basically not having a panacea, not having a pill that I can give people. They would love it if I had a pill that they have to be engaged in their own problem-solving training, and they would very much like a pill. So I think it's getting the caregivers engaged and forming those relationships. And then I think the hardest part is leaving those relationships knowing that they could use some more face-to-face down the road. It just doesn't end after 6 months or 12 months.